So what is a symptom imperative and why is it so important to know what it is? So if a person is suffering from chronic pain, back of his neck, he goes to a specialist, he gets medication, he's feeling good, no more pain. What the symptom imperative is going to state, and this is based off 30 years of experience by Dr. Sarno, so this is not made up, this is what he's actually observed, is that symptoms will just jump from one to the next. So as you relieve yourself from one symptom, another symptom will pop up and take its place. Why? Because as long as you don't get to the root of the problem, which would be understanding that it's coming from the mind, and understanding that the mind is protecting you by way of distraction, and getting to the sources of your rage and the unconscious emotions. And if you're not going to acknowledge that, you're going to continue having physical symptoms. I want to say, well, it's because of a structural abnormality, it's coming from a herniated disc, it's coming from a nerve compression. If that's what you're going to keep on saying, then unfortunately we're going to continue having symptoms. And this is a problem. Because you're going to continue seeing doctors, you're going to continue being on medication, which probably has side effects. You might still be on restricted diets. You might have to restrict your physical activity. And what type of life is that? Understanding this idea of symptom imperative and knowing that symptoms will just bounce from one to the next until you acknowledge that you have a brain-body disorder. A lot of people don't want to admit it. It sounds kind of crazy. Like, what do you mean? What do you mean? Anything with emotions, people get very, very defensive. No, we're talking about unconscious emotions here. You don't even know that it's there. So what is there to be embarrassed about? So until you acknowledge that you are suffering from a brain-body problem, a psychosomatic issue, brain-body issue, you will not be able to get better completely because we're just band-aiding symptoms here. We're not getting to the root of the problem. And once you get to the root of the problem, the symptoms are going away by way of cure. If you cure it, it's no longer there.